Welcome back to Inside the Dollhouse, where wellness meets realness. I am your host, Nurse Drippiana, licensed nurse, founder of Dollhouse HQ, and your recovery bestie who's here to help you glow from the inside out. Now, listen, around here, we don't just talk fluff. We're talking healing, hygiene, and all the hot topics that matter before, during, and after your surgery journey. If you know me, I'm all about wellness, love, and support, but I will always keep it raw and unfiltered because your safety and self love journey deserves nothing less. An informed decision is the best decision. So I'm here to inform you, friend. Today's episode, oh, baby, it is a juicy one. We are unpacking the rumors, the real talk, and the recovery facts. You ready? Does a BBL really smell? And if you've been anywhere near the Cardi B and Stephon Diggs headlines this week, then sis, you already know why we're diving into this. Let's talk about what's true, what's toxic, and how post-op hygiene is the unsung hero of a safe and stunning transformation. Now grab your tea, or your Hibiclens wash, or even your Dial Gold. Let's get into it. Does the BBL smell? Post-op hygiene 101. All right, babe. Let's get into the part no one wants to talk about, but absolutely everyone needs to hear. Does the BBL smell? The answer? Not the surgery itself, but your post-op hygiene can absolutely be giving, what the hell is that? And if you're not on top of it, and honestly too many people are actually scared to say it, the truth is healing is messy. Beautiful, but messy. Let's get into why that post-op scent might be less than fresh and how you can fix it without shame and just game, which is what I'm here to give you. Number 1, drainage equals funky town. Population 1, and that's you. Your body is working overtime flushing out toxins, lymphatic fluid, blood, sweat, maybe even a little leftover anesthesia. That fluid collects fast under your faja and pads. And honey, if you're not changing them often or giving your skin time to breathe, it starts to cook up a little post-op potpourri, and it's not Chanel number 5 type of potpourri. What to do in this instance? Change your dressings regularly, even twice a day if needed. Wipe down with antiseptic or baby wipes between showers. Air it out if you can, and you know what I mean by it, even if it's just for 15 minutes. Number 2, limited mobility equals missed spots. Let's keep it 100. You're not bending, you're not twisting, or turning like your normal self. So these easy to miss places, they're getting missed. Behind your knees, under your arms, under the faja, between your cheeks, girl. Yes, there too. And bacteria. Antibacteria, she loves a warm, neglected crevice, and you guys give it to her. What to do? Use a body wipe and or a soft loofah on a stick to reach tough areas. But here's what you really should do. Ask for help. Your caregiver, the one you're paying, or recovery nurse, the other one you're paying, should assist you in full body hygiene if you can't. Also, keep a mini cleanse kit by your bedside that has wipes, gloves, deodorant, gauze, just to kind of keep you comfortable. Number 3, the faja equals funk locker. Listen, I love a snatch waist as much as the next doll, but wearing a faja 24/7 with no ventilation is like living in a microwave in July. You're sweating, you're draining, you're layering pads and foams, and if you're not washing it daily, sis, you are fermenting like kimchi. What to do? Rotate between at least 2 fajas, one to wear, one to wash. If you can have 3 fajas, one in the closet, even better. Always wear a clean cotton layer underneath to absorb moisture. Consider antibacterial spray lightly in high sweat zones. Very important, the lightly part. Number 4, wound care slips equals bacteria's black party. Those little holes where your drains were, or your incisions that they use to suck out all that unwanted fat, if not cleaned and covered properly, they become prime real estate for bacteria. Mix that with sweat and tight compression garments, you're asking for odor, irritation, or worse, infection. What to do? Follow your wound care instructions to the letter. You know, that packet that the doctor sends you home with that you don't necessarily look at? It has a lot of helpful information. Definitely check it out. Follow those instructions. And don't forget, we don't want to rush the healing. Do not rush the healing. Covering your incisions does not mean neglecting if they are clean and dry. They need to be changed every single day. We can't just cover it and forget it for a couple of days. That's going to be a problem. So spot clean your incisions with gentle antiseptics if needed, and always pat dry. Bottom line is the BBL does not stink. But you know what does? Bad hygiene. There's no shame in not knowing, but now that you do, because you're here inside the dollhouse where we keep it 100, let's keep that body fresh. Let's keep that body clean and healing beautifully. You deserve to glow, not just on the outside, but in how you feel about yourself during the recovery journey. Hygiene is self-love, babe. Period. Let's keep it clean. Let's keep it cute. Let's learn how to stay fresh post BBL. All right, now that we know why things might smell a little off, let's talk about how to fix it and prevent it, because smelling like surgery is not on brand for the baddies we're building over here. Here's how you keep it clean, cute, and completely infection-free, even when moving hurts and standing up straight isn't in the cards yet. Number 1, wipes are your best friend. Stock up on fragrance-free, alcohol-free cleansing wipes. You need these for in-between showers, freshening up armpits, between the cheeks, under the breast, under the faja, basically all your hot zones. Think of it like a grown woman's sponge bath with soft hands and no judgment. Pro tip, add some witch hazel or a little micellar water, the face toner, to a cotton pad for a gentle cleanser if your wipes irritate you. Sometimes those antibacterial wipes can't irritate sensitive skin. So this is just a way that you can still get the job done, but in a more sensitive fashion. Number 2, I want you to shower strategically. Once you are clear to shower, that is. Don't just rinse and run. Take your time. Let that water hit your lymph nodes in your neck, your armpits, your groin to support the drainage. Enjoy it. This is your time. Visualize yourself in a spa. Let the water flow over you and rinse you and free you of whatever regrets, whatever feelings you're having about the surgery. Let it all go in the shower. During this time, you also want to use a fragrance-free antibacterial soap like Dial Gold or Dr. Bronner's Baby Unscented. You always want to pat your body dry. Never rub. If you have rubbed your body after surgery, then you know exactly why I'm saying that. So pat dry, and then you put on your clothes or your whatever ointments you want to put on, but never rub your body dry after a shower, especially in the first few weeks. Fair warning to prevent infection and to prevent any type of issues at your incisions, do not let the water hit your incisions with full force or soak in a tub until your provider clears you. I know it may feel good to have the water beating on your back, but it is not wise, especially when those incisions are not fully healed. We do not want to turn your fresh wounds into a bacteria jacuzzi, and you don't know what is in this water that comes out of these pipes when you go certain places to stay. Number 3, layer like a pro. Wear clean, breathable cotton under your faja. I'm talking tank tops, tube tops, or disposable pads to absorb sweat. Change these multiple times a day if needed. If you're dripping, don't double down. Swap it out. Have at least 2 fajas in rotation. One on, one drying, and like I said, one more in the closet. So it's just a little bit easier on you. You're not worried about the laundry getting done so that you can put back on that next faja. 3 is a perfect number. You don't want to smell like old compression and regret. Let's just properly prepare and get the 3. Number 4, lymphatic massage equals drainage queen. It's not just for shaping, it's for detoxing. Regular massages help flush toxins out of your system faster, reduces swelling, and major key alert, keeps your body from holding on to funk and fluid, which is the entire premise of this podcast. The massages are very important. Book someone licensed who uses proper technique and clean linens. No bare mattress massages. We're not doing that. Number 5, IV hydration and internal support. You can't detox through dry skin, sis. Dehydration equals stagnation, which equals funk. Hydrate from the inside out with water, herbal teas like arnica, or post-op IV drips, or like I like to say, and post-op IV drips that are rich in vitamin C, zinc, and glutathione to help your body cleanse naturally. If you are healing here in Miami, please reach out because I got you on the post-IV drips. Your lymph system is water powered. If you're dry, you're clogged, period. Lymphatic system needs to be boosted and maintained to manage your immune system. So if we have dehydration, poor lymph fluid movement, you are clogged and your healing process is just going to be delayed. Number 6, mirror checks and mirror talk. Take a mirror and look, really look at yourself. Then I want you to smell yourself. Be honest. This is not about shame. It's about healing with love. If something doesn't smell right, feel right, or look right, please say something. Don't wait. You paid good money for this surgery. Let's protect your investment and your peace. Bottom line is, you can absolutely smell sweet and stay safe after surgery, but it takes planning, intention, and support. And yes, sometimes it takes a village and a few extra pack of wipes. Inside the dollhouse is your village. So give me a ring, give me a call, shoot me an email. How can I help you glow up with ease and keep your peace? The real glow up does start with you. Let me bring this full circle. Cardi B didn't even say it. That infamous BBL smell comment, that was Stefan Diggs stirring the pot on the internet. But Cardi, of course, caught the heat, as usual, because she's one of the faces of this surgery era. So let's clear it up. BBLs do not smell, but neglecting hygiene during recovery, that can absolutely cause some not so cute situations. And that's not exclusive to BBLs. That's basic wound care 101. If nobody taught you how to care for your body post-op, that is not your fault. But now you know better. Clean recovery is sexy recovery. You're walking around in layers of foam, pads, compression, leaking fluids, drains. It's not the time to be cute. It's time to be clean. Peri bottles, chlorhexidine wipes, probiotics, fresh linens, these are your new best friends. The goal isn't just to be snatched. It's to be safe, smooth, and smelling like shea butter and self-respect. And trust, if Cardi had me or any of the dripping wellness nurses on speed dial, you better believe she'd be handing out post-op protocols with that same energy she's giving Fashion Week. So let this be your reminder. You did not go through all of this just to be in pain or confused. You did it to feel good. You did it to reclaim your confidence and to walk into every room like it's your name on the lease. That's the real flex. Healing well. Looking good is great, but feeling good and knowing you're cared for yourself? Knowing that you cared for yourself every step of the way. Now that is power. Thank you for stepping inside the dollhouse with me today, where the real glow up doesn't stop at surgery. We're prepping minds, nurturing bodies, and telling the truth, even when the internet won't. Until next time, glow smart, heal strong, smell divine. Until next time.